While it's important to be able to coach people on making changes on a day-to-day basis, looking at numbers day-to-day and making those micro changes to help improve those numbers, it's actually more important to have a way to look at the trends over time. So a few examples might be sitting down with a client and pulling up a graph or a report that shows them their time asleep over the last month. Or you may want to look, for example, at their heart rate variability over the last week when they were traveling. And maybe you want to show that compared to a week where they were not on the road and they were at home resting. Or perhaps you want to look at the resting heart rate data from the ring as an individual has started to do more cardio and you want to show resting heart rate coming down. In all of those cases, we need a tool to be able to trend the data over time, and that's the reports page. So to access the reports page when you log in, just click on an individual client's name and you'll see the reports tab here. And this is going to allow you to start graphing data over time. Typically, this can be done as part of a consultation. So you may be sharing screen and bringing this up and showing it to someone. Or you may want to create a report, download it, and then review it with the client after the fact. Let's look at both use cases. So first use case is I want to pull up a report either on my own time as part of a review or on a consult with a client. So on the reports tab, you can start to pull up the Oura metrics that you want to look at. I typically recommend turning on advanced view because it's going to give us some ways to compare the results to the prior period. So let's look at time asleep from Oura, and let's look at the past month. You can also look at the past week, the past year, month to date, quarter to date. But let's look at time asleep for the last month, and it's going to automatically compare it to the prior month. Now, maybe you want to compare it to a different month. That's totally fine. You can look at any time period and compare the result to any other time period. But you can see over the past month, this individual has averaged 6.11 hours of time asleep. Their maximum was 7.3 and their minimum was 4.5. It's also going to compare it to the prior month. So you can see relative to the prior month, it's about flat, maybe down a little bit. You can see in the prior month, this individual had a huge night of sleep, 12 hours. So that number relative to current month is down. And then there's a couple nights of bad sleep in both periods. But the reports page lets us pull up the past month for sleep. Let's look at a different example. I'm going to clear the report here. And let's look at HRV. So for this one, I'm going to pull up HRV, and I'm going to choose HRV from Oura. And let's look at year to date in this example. So let's look at 2024. And let's compare it to 2023. And so here you can see that HRV year to date is actually up significantly. We're up 18.9% on the year. A couple of things on these graphs, as you'll see down below, we have both the average and we have the raw values. When you're looking at a lot of data, this can get really noisy. So you can turn off the discrete data points and just turn on the smoothed out trend line. And you can see from the start of the year, we are at about 30. By the end of the year, you can see we're close to 50. That's a huge improvement. So maybe we want to create a report that we can actually share with the client. All we do here is we hit download the PDF. That's going to create a report. And then we can either share that with the client during a review or send it to them to show them how much progress they're making on the program. But a really simple example of just looking at improvements in HRV year to date. In other cases, we may want to look at more than one metric. So we know that HRV has improved this year. Let's also look at deep sleep. And again, I'm going to turn off the raw data points and just show the smoothed out trend lines. You can see deep sleep actually has gone down significantly this year. Let's look at REM sleep. And we can see that REM almost flat relative to last year. And let's look at resting heart rate on the ring. So here we're starting to put multiple metrics together. You can put up to 6 on the graph at any given time. This starts to get really noisy, but what you're really looking for down below here are the trends. And you can see resting heart rate's gone up a bit, deep sleep down, REM is flat, HRV is up. So we can start to build a story of multiple metrics. And again, just like before, we can download this report if we want to share it, or we can just pull this up real time. Now let's look at one more example where we may want to combine data from different devices. So let's look at HRV from Oura. And let's look at, well, we'll keep it on year to date. Let's also look at steps from the Apple Watch. And let's look at blood pressure as well. And I know that this individual client is tracking their blood pressure manually. So now I've got data from 3 different devices. Again, I'm building a story. How is my client doing over a given time period? If I've got them on a specific protocol, is the protocol working? When did they start the protocol? And let's see how the numbers are changing as they're on the protocol. That's what we can do on the reports page. And here we've got a story where steps are down, HRV is up, blood pressure is down substantially. So now we can actually create that report. Again, we've got a really good story. And part of what we're doing here is validating outcomes. And the outcomes are validated with the data. So this is a fantastic story where we've got a massive improvement in HRV and a very, very significant improvement in blood pressure. So that's the report page. You can really come in here and look at any Oura metric. You can look at multiple metrics from multiple devices. And what are you really looking for? You're looking to show progress over time, and you're looking to make sure that the protocol you have the individual on is working the way it's supposed to work. So that's the reports page. Any questions, just hit us up, support@headsuphealth.com. Thank you.